Okay. Good morning, everyone. Welcome. It's a real pleasure to be here with all of you today. We have colleagues here in the room with us in Fiji. We also have colleagues attending online virtually from all over the world, actually. And we also have colleagues all around the Pacific meeting in virtual locations today across many Pacific countries. So Fiji, Kiribati, Vanuatu, Tonga, Solomon Islands, Samoa, FSM, and RMI. So a real warm Pacific welcome to all of our colleagues that are joining us here today. My name is Kathy Taylor. I'm the International Program Coordinator working at the UNFPA Pacific office, and I will be one of the MCs and the moderators today. We're really pleased to have everyone here with us today for the launch of the Women and Young People with Disabilities Needs Assessments that have been carried out in Fiji, Samoa, and Vanuatu. This has been a long coming event. We started this work about 3 years ago, and due to the COVID epidemic, it took a long time for these reports to come to fruition. So we're extremely excited to be able to share this with you today. This is part of a much larger program called the Transformative Agenda Program that is generously funded by the government of Australia and works across 6 countries here in the Pacific. So we're really excited to be able to share with you today the results of these needs assessment reports and to also speak to you about some of the other work that we're doing to mainstream disability inclusion here in the Pacific. So without further ado, I just want to give a warm welcome to everyone. And I'd also like to then pass over the mic to my colleague, Susanna Phillips, who is the Deputy Director of Women Enabled International, one of our key partners. Susanna, over to you.
Thanks so much, Kathy, and welcome everyone. I'm so excited to be here with all of you today as we release these needs assessment reports on access to essential sexual and reproductive health and gender-based violence services for women and young people with disabilities in Fiji, Samoa, and Vanuatu. These reports, which as Kathy mentioned, have been a long time coming, really center the voices and experiences of women and young people with disabilities in the region, which we know are all too often hidden from view and silenced. It marks a significant contribution to the knowledge base around key issues impacting women and young people with disabilities across the Pacific. Moreover, as we'll hear today, and as Kathy alluded, the findings and recommendations from each of these reports are informing our ongoing work in partnership with UNFPA and other implementing partners across the region to really ensure that disability inclusion is at the heart of ongoing efforts to strengthen access to these essential services in the region. So I want to thank you all for joining us for today's discussion. I'm really excited to delve into the findings of the reports in more depth, and just great to join you all from Austin, Texas. And I apologize for any background noise. There's a very big storm here today. So hopefully my electricity will hold out so I can join for the full time. Back over to you, Kathy.
Great. Thank you so much, Susanna. And without further ado, I'd really like to take the time to introduce our next 2 speakers. So we'll be hearing opening remarks from Sally Mackay, the Assistant Director of the Global Health Policy Branch at DFAT, and Iori Kato, the new Director of UNFPA Pacific Sub-Regional Office. So before I introduce them, I'd just like to share a little bit of information about them. So Sally Mackay is the Assistant Director of the Global Health Division of the Australian Department of Foreign Affairs and Trade. She has been working on sexual and reproductive health and rights for the last 7 years. Her work includes developing and leading DFAT's international negotiating position to advance sexual and reproductive health and rights in multilateral forums, managing DFAT's global relationships with UNFPA, the International Planned Parenthood Federation, Marie Stopes International Reproductive Choices, and managing the $30 million transformative agenda for women, youth, and adolescents in the Pacific. She also manages DFAT's investment in the UNFPA Supplies Program, which provides the majority of contraceptive commodities to the Pacific. She has previously held diverse roles in the Australian Aid Program, including postings in Sri Lanka and South Africa, as well as Papua New Guinea. Sally has a master's degree in public policy from the Australian National University. So Sally, a very warm welcome to you, and we'd like to invite you to share your opening remarks.
Can you hear me, Kathy?
Yes. Can
Great.
we turn up the volume, please? And Sally, maybe you can max out your volume, please.
Yes.
Now we can hear you.
Okay, great. And is the video on, or we'll leave that on off? Just checking. Mine says it's off.
Can you turn it on?
No, I can't. The host has stopped it. That's okay. I'm happy to press.
You should be able to do that now. My apologies.
Okay. That's okay. There we go. That seems to be working. Hopefully you can see me now.
Yes,
Well,
we can see you. Wonderful.
Wonderful. Having IT success this morning. Bulat, talafu, hello and good morning, everyone. I'm going to begin today by acknowledging the traditional custodians of the land from which I am speaking, which is the Ngunnawal people, and pay my respects to their elders, past, present and emerging. It's a real pleasure to be here today on behalf of the Australian Government to join partners, UNFPA, the Pacific Disability Forum, Women Enabled International, to launch these really important reports. I'm so pleased to see there are so many people participating in this virtual event, or it's a face-to-face event for some, which is wonderful to see us being able to come together. There is a huge richness and depth to the reports, which are informed directly by the experiences of women and girls, men and boys with disability in Fiji, Samoa and Vanuatu. As many of you would be aware, Australia has a long-standing commitment to advancing the rights of women and girls and to disability inclusion as a key priority across all of our investments. In the Pacific, Australia has long-term investments to support Pacific Island countries to meet their commitments to gender equality. And this includes a new flagship program that's standing up right now called Pacific Women Lead, which has a focus on women's leadership and women's rights, including safety, health and economic empowerment. A key part of Australia's focus on gender equality in the Pacific is sexual and reproductive health and rights. They're essential for the health, social, economic well-being of women and girls across their life cycle. So for us, this includes ensuring people everywhere have access to quality information they need to make informed decisions about their bodies, access to respectful, dignified, inclusive services that people need to live the life they choose, and that their right to the highest attainable level of health is fully realised. And that's why the Australian government is investing in a number of complementary activities in the Pacific to improve services and information to women and girls, including through UNFPA, UNFPA Supplies, International Planned Parenthood, and actually a wide range of other organisations who have worked so well together in recent years to advance some of these really important issues. Disability inclusion is a key priority throughout all of these activities, because we know, and as Susanna pointed out all too well, that often women and girls with disabilities are left out of services due to stigma, discrimination in services, lack of information, lack of the education they need, inaccessible infrastructure, and a range of other barriers. We are so pleased to see some of the work being done by our partners. And just as an example of that, which we've been so pleased to see move forward, is some of UNFPA's work in assisting Pacific governments to implement training for health workers that include those vital skills to be able to meet the needs of people with disabilities out in all of those service delivery points across the 6 countries where this program works. We know that UNFPA is also providing technical advice to strengthen government policy on reproductive, maternal, neonatal, child and adolescent health that specifically articulates the importance of ensuring access to services for people with disabilities. And also working with governments to review national midwifery curricula, integrating disability services within that curriculum, which is vital when we think that midwives provide something like 95% of family planning services. So there's key points in the system that we're managing a great partnership with UNFPA that is tackling some of the most important points. I really wanted to acknowledge the women and girls with disabilities who shared their experience and stories during the needs assessment. That's really not an easy thing to do, but particularly talking about something as personal and intimate as sexual and reproductive health needs and personal requirements. It's very important to the Australian government that we hear directly from people with disabilities themselves and from their representative organisations. And in fact, that consultation process with people with disabilities and their representative organisations is a key criteria in how we assess the effectiveness of some of our partners. We know that too often the stories of women and girls with disabilities are not heard, ignored, not acted on, and we really are committed to changing that. We need to look at the underlying attitudes that are often a cause of discrimination. And we need everybody within a society to realise the inclusion of disability is a value for everyone. The way to change those attitudes is in part by empowering people with disabilities to tap into their own very high value for the rest of us to listen to their experiences, their aspirations, their needs, and also by setting clear expectations of government, service providers and leaders to respond to those needs through high quality, inclusive, accessible services. And this is really why Australia is so pleased to be partnering with UNFPA, Women Enabled International and the Pacific Disability Forum to assess and address barriers to women and girls' access to essential services, to make clear recommendations to address the key barriers, whether they're legal, policy, social, attitudinal, physical, communication barriers. All of these need to be identified and addressed if we're going to be truly successful. So today's event is a really important step. We do have a lot to do, but it's only by working together, government, civil society, private sector, people with disabilities and their representative organisations, that we can take forward the recommendations that these reports are making to ensure quality, inclusive services and information for everyone and lead to real change in the lives of women and girls. So to thank everybody here.
Thank you so much, Sally, for those opening remarks and really helping us to set the scene about the importance of understanding the needs of women and girls with disabilities and really being accountable to them and working with them to deliver the services that they need. Next, I would like to invite Yuri Kato, our new UNFPA Pacific representative, to give opening remarks. But before I do that, I'd also like to share a little bit about his bio. Yuri Kato is the director and representative of the United Nations Population Fund here in the Pacific, a position that he just assumed here in August. So we're very happy to have our new director on board with us. Mr. Kato has spent the last 20 years working in UNDP, IOM, and UNFPA. He has previously worked as UNFPA's representative for the Philippines from 2018 to 2020 until he was seconded to the International Organization for Migration headquarters in Geneva as a senior regional advisor to the Director General for the Asia Pacific. Prior to joining IOM, he was the representative for UNFPA in the Philippines and the deputy representative for UNFPA in Bangladesh, where he also served as representative AI and spearheaded the startup and scale up of UNFPA's humanitarian response to the Rohingya refugee crisis. Prior to joining UNFPA, Mr. Kato worked as a UN Regional Coordination Specialist at the UNDG Asia Pacific Secretariat in Bangkok. He has also worked for UNDP in various capacities, including as Assistant Representative for Lao PDR, the Special Assistant to the Regional Director for the Asia Pacific. Prior to joining the UN, Yuri worked as a newspaper writer and editor in his home country of Japan. He holds a master's degree in international affairs from Columbia University School of International and Public Affairs. So I'd like to give a warm welcome to Yuri, and please share your opening remarks.
Ms. Abula, good morning to all of you. I'm a little embarrassed with the extensive introduction by Kathy, which I appreciate. But again, my name is Yori Kato. I am the new director of United Nations Population Fund for the Pacific. And it's a great honor for me to be here on behalf of UNFPA, joining our co-organizers of today's event, the Women We Enabled International, represented by their Deputy Director, Ms. Susanna Phillips, and the Pacific Disability Forum, led by Executive Director, Ms. Aseta Makanawai. In welcoming all of you in this room, and also those joining us online from across the Pacific to this launch of this groundbreaking needs assessment reports that highlight the barriers that women and young people with disability in Fiji, Samoa, and Vanuatu encounter when accessing a service related to sexual and reproductive health and gender-based violence. On behalf of UNFPA, I would like to first express our sincere gratitude to our dear friend from the Government of Australia, Ms. Sally Mackay, Assistant Director of the Global Health Policy Branch of the Australia's Department of Foreign Affairs and Trade, because without the very generous support from the Government of Australia to UNFPA Pacific's flagship program of transformative agenda, the very important research and the reports that we are going to discuss today would not have been made available. So thank you very much, Sally. I am sure you're seeing me. And also our appreciation to all the other colleagues from DFAT posts who are joining us today online and perhaps in this room too. 15 to 17% of the total populations of the Pacific Island countries are considered people with disability. And 193,000 among them are young people between the age of 15 and 24. In this context, we are encouraged by the fact that as many as 11 Pacific Island Forum countries have already ratified the Convention on the Rights of Persons with Disabilities that recognize reproductive rights which is the first universal human rights treaty that mentions sexual reproductive health. And these countries are Australia, Cook Island, Fiji, Kiribati, Nauru, New Zealand, Palau, Papua New Guinea, Republic of Marshall Islands, Tuvalu, and Vanuatu. Another 4 Pacific countries have also signed the convention with the intention to ratify it, namely Federal States of Micronesia, Samoa, Solomon Islands, and Tonga. The reports that we launched today are a significant contribution to the member states, as we have only 8 years left till the target year of Agenda 2030, including the SDGs, with a slogan of leaving no one behind. And the recommendations from the reports point exactly to what more can and should be done if to leave no one behind. It was already more than 30 years ago when American Professor Kimberly Crenshaw of Columbia Law School and UCLA put forward this famous concept of intersectionality in order to truly understand the address discrimination and vulnerabilities in a comprehensive manner. And the reports in front of you are another important testimony and reminder of the intersectionality and correlation between disabilities and reduced opportunities for income, livelihoods, access to education and health services, and increased exclusion. And when it comes to sexual and reproductive health and reproductive rights and freedom from physical and sexual violence, persons with disabilities unfortunately experience even more severe discrimination and risks compared to their counterparts who are without disabilities, as Ms. Mackay just discussed as well. What I particularly appreciated about the needs assessments was also, as Sally just said, was the reports have included first-hand personal testimonies and statements. For example, a woman with a physical disability is quoted. She said, "I am sure that if information regarding what is available in the justice system is made available to all people with disabilities and their families. People with disabilities would come forward to file reports of their sexual abuse or violence that is happening to them. Along with these kinds of testimonies, these reports in front of you have identified specific gaps in legal and policy support, health and social protection services, especially for the disabled women and youth on one hand, and also highlighted societal and attitudinal barriers faced by people with disability at the community level on a daily basis on the other hand. And this is why UNFPA, working with the Women Enabled International and the Pacific Disability Forum in our Transformative Agenda program funded by the Government of Australia, is adopting a so-called twin track approach, trying to further develop the capacities of the duty bearers to implement the disability inclusion into their national reproductive, maternal, neonatal, child, and adolescent health programs, and also work on the social norm transformation through behavioral change communications. Once again, I'd like to thank all the participants here, in addition to the impressive list of all speakers and panelists, and look forward to the outcome of today's discussion so that we as UNFPA also can continue to do all we can in our control to help the Pacific Island countries to reflect on the report's recommendations and implement those so that we can jointly create, embrace, and cherish a more inclusive society where especially women and young people with disabilities in the Pacific region can feel more empowered so as to make decisions about their own body, their sexual reproductive health and reproductive rights, and enjoy lives without the concern, risks of discrimination and violence, truly leaving no one behind. Last but not least, I'd like to thank my own colleagues from UNFPA, Kathy, Jay, and all who made today's event possible. Thank you very much, Binaka.
Thank you so much, Iori, for those opening remarks, which also further help us situate the importance of understanding the human rights commitments that the governments in the Pacific have made to implement the Convention of the Rights of People with Disabilities. So with that, I'm going to close this opening session and I'm going to hand it over to Susanna, who will facilitate and moderate the next session. So Susanna, over to you.
Thank you so much, Kathy. I'm pleased to kick off the session introducing the needs assessment research and some reflections from our lead researchers. And just by way of context, I want to describe a little bit the situation in which the research started for these needs assessments. So we were set to start our research for these reports in April of 2020. And of course, the world shut down in March of 2020, and we had to pivot our approach to this research. And in many ways, I think this couldn't have been more fortuitous because it led us to partner with expert researchers in Vanuatu, Fiji, and Samoa, who were able to lead the in-person interviews and focus group discussions that form the basis of each of these reports. And so I'm so pleased right now to introduce Judith Yakave from Vanuatu, Naomi Navochi from Fiji, and Falo Utmapu from Samoa. And I'm going to ask each of them to share their reflections from the process of gathering the lived experiences of women and young people with disabilities in these interviews and focus groups. Judith, perhaps we can start with you. I'd like to ask you if you could describe a bit the focus group discussions and interviews that you had as part of this research. And in particular, I'm curious to hear the attitudes of participants around issues related to sexual and reproductive health and gender-based violence and legal capacity. Were participants comfortable discussing these issues, or did you feel that their comfort level and their knowledge around these issues increased as a result of participating in these sessions? Judith, we can't hear you. I think you're still muted. I don't know if you're able to unmute. We still can't hear you.
Hello.
Yes, now we can hear you. Great. Thank you
Sorry.
so much. Great.
So for my reflection on the study in leading the research, a key important component of that research is that using the existing networks for VSPD, Vanuatu Society for People with Disability. When we go out, so the participants were identified by Sunflower Association, and we had to go around and getting their consent in participating. The consent for participating in the research was easy because we have been, using the PSP network. It was easy for us to get consent for them to participate, given the relationship that was established prior to that. When we bring them together for the focus group discussion, it was clear that a lot of the participants for the focus group discussions, this is their first time in coming together to hear or to contribute to a discussion around sexual reproductive health. There was reluctancy because of not knowing the information around reproductive health. So the enumerators have to really simplify, explain, repeat. I think for us it was good for the preparation of the Sunflower members to go out. We had to, do a session around family planning, around contraceptive, around all these things, just to get the enumerators understand what we are trying to collect, and also try to simplify the information in Bislama and making sure that we are not changing the questions that we want to collect. But yes, there is reluctancy because of the lack of information that they have, and it requires further explanation. For caregivers, they say that some of them didn't think it is a necessary thing for them to support their young girls or to support women and girls with disability to access family planning. They didn't think it's useful for them. And we had to have separate male and female, just because of the sensitivity around the questions being asked on sexual reproductive health and also GBV. Yes, that is the experiences that we come across. I want to flag that it was really important. It was a plus for the research, because we have Sunflower involvement and women and girls with disability themselves going around collecting the information, and VSPD as the support organization to do that. And that was a big plus for the research in Vanuatu and for the information that was collected. Thank you, Susanna.
Great. Thank you so much for sharing those reflections, Judith, and in particular for highlighting how some of the social stigma and the taboo nature of a lot of these issues posed a challenge, but also an opportunity to really strengthen understanding of the issues that the enumerators were gathering data on. So thank you for sharing those reflections. I want to pass this now to Naomi. Naomi, are you able to connect and share your reflections on gathering data in Fiji and how those focus group discussions and interviews went?
Thank you, Susanna. Bulavinaka, everyone. Without further ado, I was, as alluded to earlier, between 2020 and 2021, the research study carried out in Fiji, where we had actually had two focus group discussions and one-to-one interview in the in the Western Division as well as the Central Divisions. The focus group discussions where we had actually interviewed 31 female participants over the age of 18 and 8 male participants 18. And of course, there were also young men with disabilities as well as older women and older men with disabilities that took part in the participated in the focus group discussions as well as the to the one-to-one interview. Of course, I must acknowledge where we had to work very closely with the Fiji OPDs to allow us to interview or to reach out the affiliated organizations of persons with disabilities, particularly members from the Western and Central divisions, which were the FDPF branches from Lautoka to Nandi, as well as a few of them from Singatoka corridor. Also the Psychiatric Survivor Associations, the Spinal Injury Associations, the Fiji Associations or the deaf. There were 17 individual interviews for young men, the age under 24, as well as young women with disabilities. I guess for me, first of all, it was challenging at first, trying to gain particularly that trust from the participants to be able to openly to share their different personal experience in respect to the different impairment in the different experience that they had shared in accessing SRH services, as well as the different stigma and discrimination that they personally went through in accessing these services. Particularly for me personally alone, being a woman with disabilities, I had to somehow hold back my emotions, because when I heard about the experience of women with visually impairment, especially women with psychosocial disabilities, the different stigma and discrimination and challenges and barriers, whether it was physical barriers, whether it was barriers in accessing information, so the rightful information, some of them were not even aware of the services available around SRH, particularly the different experience in trying to access the services. The attitudes of the service providers was the biggest barriers and challenges for those that participated, who had actually share their personal experience in the research. Thank you.
Thank you so much, Naomi, especially for highlighting the tremendous trust that all of the participants in the focus groups really placed in you as a researcher to be able to share their stories. And it's really not something that comes easily to talk about these experiences, and the empathy and the trust that you showed in being able to build that rapport and gather these testimonies was so essential to unpacking a lot of the key issues and barriers that infringe on the rights to sexual and reproductive health and gender-based violence. So thank you so much for sharing those reflections. And finally, last but not least, I want to pass this to Paulo to share her experiences in Samoa with the focus groups and individual interviews that were conducted there. Paulo, passing the mic to you.
Thank you, everyone. Greetings, colleagues. In the interest of time, I would like to quickly share the reflections from the research. I was the person who was responsible for collecting the data, and also conducting focus group discussions for the participants. I had a lot of support from NOLA and the subgroups, and also Ms. Luisa Saupo, so I will talk about them in a minute. We have conducted 5 focus groups. Focus group for diverse women with disabilities who are blind and visually impaired and physical disabilities, a focus group for deaf women, a focus group for women with disabilities from rural Savai'i, focus group for persons with intellectual disabilities, and also a focus group for young men with disabilities. We also conducted, we also conducted 21 interviews, informant interviews with the members. So my reflections with regards to conducting the interview is that it was very important for us to create a safe space for the participants to share. What I mean by that is we had to translate a lot of the materials into our local language and allowed our members to express themselves in our language. And after that, we will have to translate all that and send it back to the researchers, to Susanna and the WAY team. The attitudes of the participants is that they were very aware of the very aware of their rights and the injustices that were committed against them. A lot of the participants were aware that they have been abused. A lot of the participants were also aware that, you know, that there were injustices committed against them. So it was important that they shared, and I don't know about the other researchers, but for me, it was very emotional, especially to hear the experiences that they shared, because some of them, the experiences went beyond the guiding questions. They just shared. It's like an outpouring of emotions that's being hidden. And all of a sudden someone asked them, have you experienced? And all of a sudden it comes pouring out. And we ended up with, like, the specified time went way over time. And I think the researchers actually can testify. Did the research contributed? Yeah, that's what's being discussed. Yeah, it did contributed to the awareness of rights. So I've got up here some quotes from participants. You could see on the screen. I'm sorry, due to the technical difficulties, I cannot read them out, but you guys can look for yourselves and can see what's on the screen. These are not my words. These are their words, what they have been experiencing. And these are some of the compelling quotes that they shared. So what are my reflections? My reflections is that the reports is actually scratching the surface of what the situation that's really happening. I think that a lot of the participants and looking after women and girls with disabilities are falling on the shoulders of their families. Whereas with the CRPD, it says that it's the state's obligation to provide a lot of these services. So if you read the report, you will say, oh, well, it's only a handful of people sharing, but you know, I'm telling you, it's just scratching the surface of what's happening. And the recommendations in the reports and the experiences, it goes to show that changes must happen really soon. I would like to acknowledge the UNFPA for supporting DFATs as well, and also the wonderful support from the team from WEI, and also the Pacific Disability Forum. But I think this research, I would like to dedicate it to our team at NOLA, and especially the women and young men who were interviewed in this research. I also like to acknowledge the interpreter, Marie, and also Luisa, who you could probably see here trying to operate the machine. And also she was the assistant who took a lot of the photos that you could see on the screen and gathered the consent forms. But this research is dedicated to the participants. I would like to dedicate my work on this report to you all. This is your story. This is for you. Thank you.
Thank you so much, Valo. You know, I think it's just such an incredible testament to the dedication and work that each of our researchers put into this, the tremendous trust that they built with their with the participants in each of the interviews and focus group discussions. These are not easy topics to share. And Paulo, I think in particular, you hit the nail on the head that these reports just barely scratch the surface of the reality of what people are experiencing. And in particular, hearing just how impactful and how aware each of these individuals are that what is happening to them is not right, it's not just, and that they should be able to access these services on an equal and non-discriminatory basis. And so without further ado, I want to close this session, as I know in the next session we'll get into some of the pressing issues that emerged in these interviews, but I just want to thank all of our researchers for the tremendous care that they put into building the trust and being able to gather these experiences, and how impactful it is to hear from individuals what their realities have been, so that we can understand where we've been and understand where we need to go to overcome those barriers and ensure that the rights of women and young people with disabilities are being fulfilled. So I'll close this session and pass it over to my colleague, Sofia Minieri, who will be moderating the next session. Sofia.
Thank you so much, Susanna. Yes, thank you so much, and thank you to the researchers for the tremendous work that you have done to make these reports a reality. It is a pleasure for me to introduce our next panel that will be focused on the most pressing issues impacting fundamental rights of women and young people with disabilities living in Fiji, Samoa, and Vanuatu, and key recommendations to address these issues. And in this panel, we have 4 wonderful speakers. Fadatino Utamapu, the General Manager of Nuanua Olealofa, NOLA from Samoa. Freda Willie from the Sunflower Association in Vanuatu. Anna Saini Bakaidia, Disaster Risk Reduction Project Support Officer from the Fiji Disabled People's Federation in Fiji. And Angeline Jand, Human Rights and Gender Advisor for the Pacific Disability Forum. And during this panel, we would like to invite our speakers to share their reflections, building on some of the testimonies included in the needs assessment reports for the 3 countries, for Samoa, from Vanuatu, and for Fiji. So to get us started in this panel, I would like to invite Patino from NOLA from Samoa to share her reflections in relation to the following testimony that is included in the Samoa Needs Assessment Report. So a 54-year-old woman with a visual impairment who joined a focus group discussion held in Samoa told the researchers, and I will quote her: "I cannot go to the doctor by myself or make decisions. It is always my mother who communicates to the doctor, and the doctor talks to my mother." So Tino, building on this testimony, we would like to know more about to what extent women and young people with disabilities from Samoa are able to make autonomous decisions about their sexual and reproductive health. And we would also like to know your thoughts about, in addition to these communication barriers reported by this particular woman, what other barriers are preventing women and young people with disabilities in Samoa from having access to sexual and reproductive health services? So Tino, the floor is yours.
Distinguished delegates joining us virtually and in person, representing development partners, government ministries, CSOs, and most importantly, persons with disabilities, good morning. Thank you for the invitation to share with you the experience of persons with disabilities who have been highly involved in the compilation of the reports in my capacity as the manager for the only OPD in Samoa who is managed and governed by persons with diverse disabilities. Let me begin by saying that SRHR right is not a given. It should be respected, and it is an entitlement for all of us. And as a Christian country, I think we know the story of Adam and Eve, where Eve was gifted by God with the ability to reproduce. And being the creator of all women and girls, I'm really sure that when this was granted, God did not say to Eve, okay, this is an entitlement of all, but not others. However, the experience of a 54-year-old woman with visual impairments, slide 2, please, who stated that she is unable to communicate to the doctor without her mother, really shows that women and girls with disabilities cannot make autonomous decisions on how to communicate or about their SRHR rights. It is also suggesting that the decision-making power rests with their families. And therefore, because of this, they are not able, and indeed this woman herself is unable to make an informed decision and to address her SRHR needs, which are fundamental to all women and girls, regardless of their disability. Next. This experience also tells us that there is multi-level of restriction and exclusion, as well as the discrimination experienced by women and girls with disabilities in accessing SRHR, not to mention the other essential services. These findings, and I'm sure you will be able to read the whole report as the report speaks for itself. But these findings also tells us that there are other barriers faced by women and girls with disabilities. Such as the denial of reasonable accommodation, which is fundamental to the access by women and girls with disabilities to SRHR services and programs. Reasonable accommodation includes, but not limited to, access to sign language, braille, pictorial interpretation, to name a few. In many cases, this report also suggests that the barriers to persons with diverse disabilities to SRHR services and the limited capacity to access starts from their own families. Next. It is also suggesting that there is a huge disparity and disconnect between what is written on paper and the reality. While the report speaks about challenges, it also presents opportunities for us to consider in order to improve access to SRHR and essential services by women and girls with diverse disabilities. So we are grateful to the support of UNFPA and all its partners, including women and girls with disabilities who are present here today, for the hard work in contributing to this report one way or another. The report itself presents not just the challenges, but a lot of good work that have been done and are continuing to do by our partners to enhance the rights to access SRHR by women and girls with disabilities, such as the MOU, which we have with Samoa Family Health Association, which stipulates low cost and free SRHR services that are available for women and girls with disabilities. Next. The report also can be viewed as an instrument which provides recommendation and advice, and also capacity building opportunity to government in all its forms to further realize their obligation under the International Convention on the Rights of Persons with Disabilities, which it's ratified in 2016. The obligation of states under this convention states that states must ensure to provide appropriate resources, including legislations and policies, to ensure persons with disabilities the right to access all services, information, communication, physical environment on an equal basis with others. As part of the obligation of member states, they are also responsible to ensure that legislative amendments are done to ensure no discriminatory provisions to persons with disabilities. And lastly, but not the least, recognizing the capacity of persons with disabilities to be consulted in all decisions and developments concerning their lives. As witnessed in this report, the participation of persons with disabilities through the various aspects of the report, no other data collection can better present. It also means that women and girls with disabilities are the agent for their own destiny. Yes, as an advocate of persons with disabilities, I look forward to see and hear the many fruitful programs and initiatives that will born from this significant research. I thank you.
Thank you so much, Tino. And as you mentioned, autonomy, restrictions to personal autonomy, to legal capacity are a key cross-cutting issue across the region that we have identified in all the 3 countries covered by this report, Samoa, Fiji, and Vanuatu. As you mentioned, in spite of the fact that these countries have ratified the CRPD, for many women and young people with disabilities, decision-making power rests with their families, as you mentioned, and many women and young people with disabilities still face discrimination, both in their homes and in their communities. And as I mentioned, this is something also identified in other countries where we conducted research, including Vanuatu. So I would like now to invite Freda Willie from the Sunflower Association from Vanuatu to hear her reflections about also an issue related to the lack of autonomy and how the lack of autonomy impacts other rights, including the rights to be free from gender-based violence. So in this regard, in the Vanuatu report, we have included a quote from a 26-year-old woman of short stature who participated in focus group discussions conducted as part of our needs assessment. And this woman told us, I know, and I will quote her, I know of girls with disabilities who are not allowed to go out. If they do, their families will hit or smack them. The families are protective because boys will abuse them. End of quote. So building on this testimony, Freda, we would like to know more and to explore to what extent women and young people with disabilities living in Vanuatu are able to make autonomous decisions about their lives, and whether women and young people with disabilities are able to report gender-based violence and access to support services, and in case they cannot report DBV, why this is so. So the floor, Freda, is yours.
Thank you for the opportunity for Sunflower members to participate. I'm one of the members for Sunflower, also a member of the focus discussion group. Yes, for us here in Vanuatu, for the reflection, the statement is true. Women and girls in Vanuatu, when they want to have a decision in sexual reproductive health, they cannot do it by themselves. Given that in Vanuatu culture, women are seen as inferior to men, and we are not allowed to say what we think or what we want in our homes and in the communities. And then we have disability, and that would be like a double discrimination or double, triple discrimination for women and girls having to participate in decision makings. If we do, however, as the report states, we usually get a smack or violence from our family members. And if we do have choices we want to make, like oh yeah, I want to have a boyfriend, or deciding on how many children we want, that would give a very bad feedback from our family members, and also how the male in the community look down on us. And for the second question, here in Vanuatu, we do not have, we have limited resources on communications. If we have a case, there are stories in the reports that says women and girls are being raped when they have a case to report to the police. The communication level from the police station to the courthouse is very limited. And when we end up in the courthouses, somehow the evidence will not be seen as evidence, because coming from the background, if you have if you are deaf and you cannot communicate well, that would be a barrier, another barrier apart from your disability. Yeah. Thank you.
Thank you so much. And once again, we have heard about how the lack of autonomy is a key issue across the region. And in addition, how stereotypes, stigma, and attitudinal barriers displayed by both family members and the communities have an impact on the rights of women and young people with disabilities, including their rights to be free from GBV and also to access services after experiencing GBV. And attitudinal barriers, unfortunately, are a cross-cutting issue across the region in terms of the impact they are having on women and young people with disabilities, preventing them from fully enjoying their rights. And we have identified similar trends in the case of Fiji. And to share more about that, I would like to invite Anna Saini Bakaidia from the Fiji Disabled People Federation to share her reflections about this testimony from a woman with a visual impairment who joined a focus group discussion held in Fiji. So this woman told us, and I quote her, "The community laughs and makes fun of pregnant women with disabilities. They openly make comments. Look at her having a disability and being pregnant." End of quote. Anna, considering this testimony, we would like to know more about what are the most prevalent attitudes of community members in Fiji towards women and young people with disabilities? And to what extent and how do these attitudinal barriers impact sexual and reproductive rights for women and young people with disabilities? Anna, the floor is yours.
Thank you, Sophia. Very good afternoon to everyone who's joining in this morning, whether it's virtually or in person. But also, I would like to thank especially Naomi for the assessment that was done, I think in 2020 in Fiji, where discussions were made around women with disabilities not accessing or the challenges that women with disabilities face in terms of accessing SRH services, and also, as Sophia has mentioned, the different type of barriers that these women face, women with disabilities and young people face in the communities. In Fiji, one of the main barriers that is challenging to change is the attitudinal barriers. It begins at the family level, then at the community level, and then at a broader level, where, as mentioned, that a woman with the visually impaired is being laughed and challenged by the community of having a disability and being pregnant. So in terms of the attitudinal barriers, it's the attitude of people. How do people in the community see women with disabilities getting pregnant? And also other barriers is that if a woman with a disability tries to access contraceptions, it's the way the community looks at her. When you are going to access contraceptions, whether it's at the health center or the hospital or a SRH clinic, the mindset of the community will be, or she's getting contraception, so that means she's having sex. And then another barrier is that in one of the discussions that was, I think it's highlighted in the report, is that for young women, when they are taking pills, so it's the assumption of people. If you are taking pills, people assume that's family planning pills. So at the end of the day, it comes back to the attitude of people, or the mindset of people, that is often the most challenging barrier that we can overcome. And then there are other barriers that that women with disability face in the community. There is communication barriers. How do women with disabilities in Fiji are able to have more information on sexual and reproductive health? And then, and in terms of information, how well or how accessible this information are when women with disabilities are trying to access these services. And then there are other barriers like physical barriers that does not allow women with disabilities to access these services. So in terms of the SRH services that's available, and the challenges is that first it comes back to the mindset of health workers. We have had experiences of women with disabilities that do not want to access the health services. It's mainly because the attitudinal barrier or the attitude of health workers, seeing them as a woman with disability, trying to access the services, whether they are pregnant or whether trying to get contraceptions. So the main barrier that we face as women with disabilities in Fiji is attitudinal barriers. And then in terms of accessing the clinic, that's another barrier. If the clinic is not accessible, whether it's at the hospital or at because there are areas that SRH clinics is not available, so women access this through the health centers. So how accessible is the health center for women with disabilities to access these services? And it comes back to when women with disabilities access these services, how do the communities look at them, look at women with disabilities in accessing these services? So those are some of the barriers. And then it comes back to what my other colleagues have been talking about in terms of, autonomy. How do women with disabilities or young people in Fiji are able to make their own choices of getting contraceptions or family planning or just getting a regular checkup in terms of SRH services? And in terms of communication barriers, how well are health workers or health people are able to communicate with persons with disabilities that come into the clinic? And I think in earlier, one of the earlier speakers I have mentioned is that at times when a woman whose visual impairment goes into the hospital for accessing services, when they are going with a support person, the person who will be serving would talk to the carer or the support person instead of talking to the woman with disability themselves. So this is some of the little bits, the barriers that we as women with disabilities face here in Fiji in terms of accessing these SRH services. Thank you, Sophia.
Thank you so much, Anna. And thank you, Freddie and Tino, for sharing these key ideas about the barriers, the attitudinal, communication, legal barriers that are impacting access to fundamental services for women and young people with disabilities, and especially in relation to their autonomy and also to their access to SRHR and TVV services. But to share more reflections about these issues from a regional perspective, I would like to give the floor to our colleague Angeline Chan from the Pacific Disability Forum to tell us a little bit more about how these trends that we have identified in Fiji, Samoa, and Vanuatu are also somewhat replicated across other countries in the region. Angie, please, the floor is yours.
Thank you, Sophia. Good morning, distinguished guests, colleagues, ladies and gentlemen. The Pacific Disability Forum was proud to be part of this project, supported by UNFPA, and working on it together with our organizations of persons with disabilities in the three project countries, which is Fiji, Samoa, and Vanuatu, and supported by Women Enable International. I guess the regional findings is no difference for which my colleagues have shared, the lead researchers in these three countries. And one thing I would like to allude to is the Convention on the Rights of Persons with Disabilities talks about all human rights for all persons with disabilities. So it means those of us who have difficulty in seeing, difficulty with hearing, those of our colleagues who are deaf-blind, those who have physical disabilities, those colleagues of ours who have physical, psychosocial, and intellectual disabilities as well. So as you heard from the lead researchers, these different diverse impairment groups shared their challenges when accessing SRHR services. And I would like to allude to data and statistics, which is very important because often we are asked, how many persons are you talking about? Where are they? Are they able to access these services? And what the Pacific Disability Forum is doing, working with our different governments of the Pacific Islands, is the use of the Washington group of short set questions, is to determine the data that we after. So it's asking us the difficulty that one faces with a 6 short set of questions. So we hope through that, when it comes to service, program implementation, policies, legislation, that those data are interpreted in those pieces of work. Across the board, like my colleagues have just said, attitudinal barriers is on the top of it all. Stigma, as Anna just spoke about, so I don't want to get more into that. Accessibility to the built environment. Are we able to access the SRHR services? Access to information. As you can see, those of you who can see, I use a talking software on my laptop. Without this, I cannot access information that's given to me in print. So is that readily available? Also for our colleagues who are deaf, do we have sign language interpreters? And I would like to also acknowledge the International Sign Language Interpreter who's here with us virtually today, and also in the countries, in the different project countries. And the other thing is access to transport. Are we able to access the transport systems that's available in our countries to be able to access those services that's there? Then we talk about assistive devices. Do we have the appropriate assistive devices to access those services? Support services, which my colleagues also talk about. And it's about the appropriate support services. As you have noticed today, I came here with my colleague Maria Miller from the Pacific Disability Forum, because I don't come to Holiday Inn every day, so she has to guide me. And as rightfully pointed by Anna, often the dialogue is between the support person and not with us directly. So we would appreciate when accessing services that whoever is involved in attending to us talks to us directly. Then you talk about social protection. This is not handouts. In the case of Fiji, I would like to highlight that they have a social protection system where it's available to all persons with disabilities, and it's not only to those who are not working. If you are working, if you're not working, you can equally access that services. Why? It's to cover for the extra cost of disability. Everyone doesn't have to buy a white cane like some of us do. Everyone doesn't need a wheelchair. Everyone cannot travel by a bus. So my colleague Naomi has to travel in a taxi. So she has to pay 3 times more than I have to pay. So those are what social protection. And then we talk about community-based inclusive development. So to deal with the issues, the barriers that we face, it needs a community approach where we have the different stakeholders. So if I live in a community, I need to be able to access the services that are available to everyone else, and I should be able to access that as well. So it has to be available to me where I am. And then finally, it leads to non-discrimination. So if all the other 5 areas are dealt with, we persons with disabilities, women, young persons with disabilities, we also dream of this society where there is no discrimination. We can access all services, including SRH services, on an equal basis with others. So finally, we look forward, there's a lot of recommendations in the report, how we can work together with each and every one of your organizations, with UNFPA, with Women Enable International, to move this area of SRHR for women, young persons with disabilities. So the Pacific Disability Forum will be very proud to work with anyone and to make this a reality, because persons with disabilities dream of the same aspirations like any one of us. Thank you very much, Sophia.
Thank you, Angie. Thank you, all the staff of the Pacific Disability Forum for being such great partners to make this research possible. And I would also like to thank Frida, Anna Saini, and Tino for your presentations today. And of course, thank you organizations, NOLA, the Sunflower Association, the Vanuatu Society of Persons with Disabilities, for your support also to make this research possible. It's time for me to share the floor with my colleague, Anastasia Holobov, who will facilitate and moderate the next panel. Anastasia, the floor is yours.
Thank you, Sophia. Hello, everyone. It's a pleasure to be with you tonight and today. I'm here to move us on to a session where we can really see an example of how those recommendations that we've been discussing throughout this session are being implemented. So as documented in the Fiji report and reiterated by our speakers today, many women and young people with disabilities in Fiji feel uncomfortable discussing SRHR and lack of access to comprehensive and accessible information about these SRHR issues and the services that are available to them and how to access these services. In this context, a significant number of women and young people with disabilities do not have access to a full range of SRH services, as we've heard described today for a variety of important reasons. To address this issue, a key recommendation from the report, as well as in the Samoa and Vanuatu reports, is that for the state to partner with OPDs, organizations of persons with disabilities, and service providers to train and recruit women and young people with disabilities to serve as community health liaisons to provide peer-to-peer education and accompaniment to SRHR and gender-based violence services. So in Fiji, to implement this recommendation, the Fiji Ministry of Health and Medical Services, UNFPA, the Fiji Disabled People's Federation, Medical Services Pacific, the Pacific Disability Forum, Reproductive and Family Health Association of Fiji, and Women Enabled International are working along with sexual and reproductive health officers who themselves have disabilities to conduct outreach activities aimed at expanding demand for and access to sexual and reproductive health information and services among women and young people with disabilities living in the central and western regions of Fiji. Outreach for the project is beginning next week. So I have today 2 key stakeholders in that project who will be giving us more information about the pilot, including the goals of this intervention, the main partners, and basic information about the outreach strategy that is being implemented. So to kick us off, I'm going to turn it over to Dr. Rachel Devi, who's the head of Family Health, the Family Health Unit at the Fiji Ministry of Health and Medical Services, who will share with us the role of the Ministry of Health in this important pilot. Over to you, Dr. Rachel.
Thank you, Anastasia. I hope I'm heard well on Zoom. Yeah, thank you so much for the opportunity. And firstly, I must acknowledge the Ambassador for Women and Children of Women and Girls, Miss Sally McKay from the DFET Canberra, and our UNFPA Director and Representative. Welcome to the Pacific, sir, Laurie Kato. And also acknowledging Women's Enabled International, who's worked with us pretty significantly, and the Pacific Disability Forum, the FNCDP team, and FDPF. You know, the one thing I'm glad I saw in one of the slides from Samoa was the word need. I'm not sure if you observed that or not, but I saw the word need there. And if I could ask us a rhetorical question here is, SRHR is a need for every individual. That includes person with disability. But unfortunately, it's looked a bit differently when it comes to individuals with disability. And I know the reports don't deny that. I know the facts don't, and it's been spoken of by a lot of my colleagues who've spoken before this from the disability group. So I just acknowledge that aspect that, and you know, everyone has hormones and there's needs to it. That's one thing that's so important. And one of the other aspects that my friend here, Naomi, mentioned was attitudes. This assessment itself has shown significant barriers. It has shown a lot that we really need to work towards. It's shown a lot that it's basically paved a way in terms of what direction, what way we need to take. Just a few weeks ago, the Minister of Health with the FDPF, Anasani and the team, we did a training, so more of a planning exercise and a training capacity building opportunity for both persons with disability, the FDPF team and the Minister of Health from the various divisions. I believe some of them are joining us here today from the Western and the Northern Division. And as we roll out this pilot, during that training program, you know, there was something that really enlightened all of us. And there was some simple things on how we could do some immediate aspects. And I spoke of it last week at our regional GBV meeting is the basic sensitization of healthcare workers on the need, on how to approach individuals with disability. And challenged my team in terms of organizing this as we progress in this space. And that was something simple that we could do, because sometimes it's just the simple sensitization that makes a world of a difference. That makes a world of a difference in terms of our attitudes towards individuals, the community's attitudes towards individuals. And thus, you know, while I have my Pacific colleagues here in the forum today, you know, this is something that I'd love to encourage you to take on board as well. At this regional meeting last week, when we discussed GBV, when I shared this, you know, this is a challenge that we need to take back, and that's simple sensitization. And I must say, we've all heard that nothing about us without us. And I think the same would be shared by the team that's here with us, especially from Fiji, FNCDP, the Pacific Disability Forum and all. But it's such an important platform that we really build up on and I must say for Fiji during this pilot itself, I'm not going to dwell so much on the pilot because Anasani is going to talk about it. But, you know, when this project came up, there was no doubt we needed to do this. There was no question about it, because it was a pilot project and an opportunity for us to learn as to how we could increase the access of SRH services. And who better to do it than working with individuals with disability, like, because obviously they understand the population better, and it gives us that opportunity to learn from them as well, and to, you know, roll this out. And we will be rolling it out in the 2 divisions, in the Western and Central. But at the same time, one of the things that Ministry of Health has done is we've brought in the Northern team so that they could learn as we progress with the pilot. So, you know, we know there'll be a lot of learning from the pilot. So once we're able to roll it out proper, we can have the North team pick it up and run with it as well. And apart from these few things, we know that while we know that this is a need, this is a place of emphasis. One of the things that the Ministry of Health is doing is we're making this a part of our bigger agenda items, such as our strategic plans for the unit, our business plans for the program. So, this is a significant step of adding these components into our plans as well, and building up on it in the years to come. And one of the humble requests, I think, as an island nation that's working on the transformative agenda, is we know this transformative agenda is coming to an end this year. And I'd love to see, and I believe I speak the same sentiments of Tonga, Vanuatu, and Samoa, and the others that work with the transformative agenda, if this could progress, because we've just started. This is not even the depth of things, but we really need support. We really need that opportunity to build up and move forward, and hoping that the same can be built up in the upcoming phase, the next phase of the transformative agenda. So, we can really step in this space. So I just want to take this time to, I think I will give a lot more time to Anaseni to talk about the project in itself, but I must say it's a very significant collaboration. It's an important one, and we're looking forward. We're really excited in the divisions, and we've got our structure within the health is such that we've got divisional sexual reproductive health clinics. So these teams will be working with the FDPF will be working with these teams in the divisions and rolling out the program. And as Anastasia mentioned, it's starting next week. So they've got their planned out program ahead of us, and they roll out next week. And we look forward to results. It's a lot of learning from in itself, but an opportunity we really need to build up on. And I must say, this is just the beginning, and a lot of learning ahead. And the needs assessment in itself will be a significant contributor to what we will be stepping into in days to come in terms of response as well. But thank you so much for the opportunity to share the platform and to share the pilot program that the ministry is doing with FDPF and the WEI and others. So thank you, and over to you, Anastasia.
Thank you so much, Dr. Rachel. And thank you so much for laying out the Ministry of Health's commitment and really serving as an example, both in the region, but also globally, of how key ministries of health are to realizing these recommendations and, the steps such as sensitization that are really critical and can be a low cost and easy first step to really creating that disability inclusion that is so key. As Dr. Rachel previewed, Anaseni Vankiti is going to again give us an overview of what is happening in Fiji, and specifically her role as the community-based SRHR officer pilot project coordinator, and how she is leading this groundbreaking initiative and making it happen. So over to you, Anna.
Thank you, Anna. This afternoon, I will just provide a brief summary in terms of the pilot project that's is currently going on in Fiji right now. And so this started way back in, I think it was in March, where our partners came on board. So in terms of this pilot project, we have partners from UNFPA, Women Enable International, Pacific Disability Forum, Ministry of Health under the Family Care Unit, which is led by Dr. Rachel, Medical Services Pacific, and also the Reproductive Health Association of Fiji. So basically, at the beginning of the project, it was just planning on how we're able to identify the 2 divisions where the project will be carried out. So the Central and the Western Division were identified. And following that was for FDPF to identify 4 women to become SRH officers in the Central and the Western Division of Fiji. So we were able to identify 4 women, 2 in the West and 2 in the Central that are working with me in terms of conducting this pilot project. So basically, REF came on board, or the Reproductive Health Association of Fiji came on board to train these women on SRH. It was basically SRH 101, how these women or the SRH officers are able to go out into the community and relay the learnings to other persons with disabilities or young people and women with disabilities that are out there in the communities in the Central and the Western Division. So following that, there was another session in July where colleagues from the Ministry of Health, Medical Services Pacific, and the Fiji Disabled People's Federation, the SRH officers, and also we included in the Fiji Association of the Deaf because when we were going into the project, then we saw that there was a pressing need for the inclusion of our deaf colleagues to also be part of the program. This is just in terms of how communication channels down to persons who are deaf that are at the community level, or women who are deaf, or young people who are deaf. So they are also part of this project. And then in July, we tried to plan out the programs or the outreaches that will be held in the 2 divisions, who will be our target audience. And initially, the plan was to have only 1-day outreach conducted in the communities. So the Fiji Disabled People's Federation has 6 branches in the Western Division. So out of these 6 branches, 3 branches were identified for this community outreach. So the branches that were identified are near to the Western Health Hub, which is located in Lotoka. So these 3 branches have been identified by our SRH officers also in the Western Division. So as mentioned by my other colleagues, we will be starting our the outreach next week. So what was planned is that before the outreach is to have a disability sensitization sessions to our health workers or to our family care hub clinic reps in the Western Division, which is in Lotoka. So we will be having that on Monday before the outreach, which will start on Tuesday. So from the planning, what we realized that 1 day is not enough for a particular local branch. So what we came up with is to have 2 days. So basically, the first day will be focusing around just an awareness session about SRH, and which will be conducted by MSP with our Ministry of Health Family Care Unit, and also from us at the Federation. Where does disability inclusion come in when talking about SRH? And then the second half of the first day, basically what we thought about is that, as highlighted in the report, that most women or young people with disabilities are not able to share the challenges that they are facing in a larger crowd. So what we thought of was the second part of the day is to have a one-to-one sessions with our members that are in the community. So the total or the targeted numbers that we are targeting is 30 per community. So the 30 also includes carers and family members or support persons that will come, or for persons with disabilities that are not able to come alone, but they are able to come with their carers or their support person, because we believe that SRH not only is for persons with disabilities, but also how can we educate family members, carers, and support persons on SRH, and also how these support persons are able to support persons with disabilities when accessing or trying to access the SRH services that's available in the 2 divisions in Fiji. So yeah, basically that's what will happen on the first day. And on the second day is that we're so thankful to our partners like MSP and the Ministry of Health through the Family Care Unit, is that they are taking down their services to the community on the second day. So the second day is basically on services, SRH services. So this would also include counseling that is also provided by Medical Services Pacific. And also the reason why that we wanted to do services on the second day is that for our participants or for our target audience, which are women and young people with disabilities, to have one-to-one sessions with the healthcare workers or people that are working in the hubs in the different divisions, and how women with disabilities are able to further access the services after the project. So it does not only end when we have the community outreach, but where to after the community outreach. So those were the main reason that we wanted to also take down the services to the different branches of the community. And then, yeah, basically we are having six awareness sessions in the different branches. And then in the central division, since we have 3 branches and also the OPD awareness sessions, what we thought of is that for everyone to just have a 2 days awareness session focusing on persons or people, young people with disabilities, and also women with disabilities in the central division. So hopefully the project is scheduled to be held on the 22nd and 23rd of September, but also it will, on the first day, on the 21st, we are also having a disability sensitization sessions with our family care unit and MSP central division. So what we are hoping to get out of this project is to document the challenges. Why are women with disabilities or young people not being able to access these services, whether it's the barriers or as highlighted earlier in the previous sessions, whether it's the community that they live in or the attitudinal barriers, or whether it's communication barriers, and those are the associated factors that does not allow persons with disabilities for not accessing these services. And after the outreach, what we hope is that for our SRH officers, is that they will do follow-up visitations and one-to-one communications with our members in the community, and find out from the outreach that was done after 1 or 2 months, how many persons with disabilities were able to access the health clinics in the 2 divisions. So basically, by the end of the project, we want to come up with the data on, okay, out of the 7 community outreach, we were able to reach 210 people, and out of the 210 people, maybe we might come up with 60 people or 50 people are able to access these services. And for the remaining, why were they not able to access the services? So basically, that's what the project is about. Supposed to end in October, but the project itself ends in December. So hopefully by December, we will be able to have a report on the work that will be done in terms of the outreach and also the one-to-one sessions, and also how many women or young people with disabilities have access to these SRH services. Thank you, Anna.
Thank you so much, Anna, for really detailing the practical steps it takes, but how it is possible to realize the recommendations that are part of the report to really make that change for women and young people with disabilities on the ground and improving their access. And thank you again to Dr. Rachel and Anna for really summarizing the joint implementation of this partnership project. And really, we are looking forward to the next steps. And as Dr. Rachel said, this is only the beginning. We are now going to move on to our last presentation, which will bring us back to Kathleen Taylor, who opened the session today, the International Program Coordinator for the UNFPA Pacific Subregional Office. Building on the evidence base that is established through the needs assessment research in Samoa, Fiji, and Vanuatu that we've heard about throughout the day, which is part of the transformative agenda, WEI and PDF have continued to work with other implementing partner organizations to share technical guidance on training packages, BCC strategies, media campaigns, information, educational communication materials, and other outputs and strategies to ensure disability inclusion across the transformative agenda program. Kathy is the International Program Coordinator for the Transformative Agenda at UNFPA, and she focuses on reducing unmet need for family planning and advancing sexual and reproductive health and rights across the 6 Pacific countries, and has a specific focus on mainstreaming disability inclusion. Prior to this position, Kathy had held impactful positions at UN Women and UNFPA across the globe, and she has a master's degree in international health. And so she will close our sessions today by summarizing how implementing partners have mainstreamed disability inclusive approaches into their work as part of the transformative agenda. And then if we have time, we will have a short Q&A session, which will close us out for today. So over to you, Kathy.
Great, thank you so much. Can you hear me? Yes, okay. Thank you so much, Anastasia. It's a real pleasure to be here with everyone today. And as Anastasia mentioned, I want to speak briefly about the twin track approach to disability inclusive programming on sexual and reproductive health and gender-based violence. So what is the twin track approach? We've been speaking a lot about the realization of sexual and reproductive health and rights and the ability to live a life free of gender-based violence for people with disabilities. So in order to be able to realize those rights, we are using what we call a twin track approach. So that entails systematically mainstreaming the interests of young women and young people with disabilities across our sexual and reproductive health and gender-based violence interventions, and at the same time taking targeted actions that specifically are aimed at women and young people with disabilities. So an example of those targeted actions would be the disability needs assessments we're talking about today that are specifically focused on people with disabilities and coming to understand their stories and their needs. And then this new pilot intervention that the Ministry of Health is also taking forward with these SRH outreach officers that will do outreach specifically to groups of people with disabilities. But at the same time, we also need to make sure that we are mainstreaming disability inclusion throughout all of our work. So I'm going to speak just a little bit about that and not go into too much detail because I know that we are short on time. But through the transformative agenda and also throughout UNFPA's other work, we have been systematically trying to ensure that we are collecting data and evidence, which we also heard Angie speak about earlier. So we have collected the health facility readiness assessments, which are assessments of almost all of the health facilities across the Pacific. And we looked at them to assess if they were accessible, if they had structural provisions, communication materials, et cetera, for people with disabilities. And what we found is that most of the facilities don't have very, very good access. Physical disability access varies from only 4% in Kiribati up to 65% in Tonga. We have also, it's not listed here, but we also have supported the multi-indicator cluster surveys to mainstream the use of the Washington group questions that Angie also mentioned. So we are trying to collect information on people with disability in the region. That information we are then using to inform the development of reproductive, maternal, neonatal, child and adolescent health policies. So we're using that information to then bring the needs of people with disabilities into the development of these policies. So for example, Tonga's draft policy currently describes that family planning information and services will be made available, accessible, and acceptable for people with disabilities, and health worker skills will be strengthened in this area. We've also mentioned that we have been supporting the development of new family planning training and supporting that national rollout. That family planning training has a specific chapter on the needs of diverse groups, and it includes specific service provision for people with disabilities. We've also been supporting the governments to review their midwifery curriculums and have identified that that is a gap in the provision of sensitive services to people with disability. So these new midwifery curriculums that are currently being developed with governments are taking into account the needs of people with disabilities. And we've also mentioned behavior change communication strategies. So we have been working with governments as well to develop behavior change communication strategies around sexual and reproductive health and family planning. And we have been taking a twofold approach there. So the needs of people with disabilities are mainstreamed into the materials, but we're also developing explicit messages that reach out to people with disability as well. And this is just to show you briefly so that you can see, sorry, I guess not everyone can see my presentation.
We can see it online, Kathy.
Oh, okay, wonderful, great. So sorry that we can't see it here in the room in Fiji, but you'll see here just some examples, some visual examples of what we're talking about. So the contraceptive flip chart that we have developed to use as an aid while healthcare workers are delivering family planning counseling. You'll see the picture below. The contraceptive flip chart is very visual. It has a lot of pictures and it's using very simple language so that when it's used with people with disabilities, it's easier for them to understand. Also, you'll see above, there is a comic here. This is from some of our behavior change communication work that we're doing with youth. This is particularly in Kiribati, where what we've done is you'll see there's a young man who's visually impaired. So we're purposely putting in pictures of visually impaired people to make this inclusive and so that people realize that people with disabilities also should have access to information and services as all other young people. We're also developing radio spots and outputs so that people with disabilities that may not be able to view this particular comic can also receive the information in other formats as well. And just to say, this year with working together with WEI, they developed some Know Your and Pacific Disability Forum. They developed Know Your Rights materials specifically around sexual and reproductive health and gender-based violence that could be used for people with disability during the COVID-19 pandemic so that they could understand their rights during this time. Beyond the transformative agenda, UNFPA is also working to mainstream disability inclusion in the humanitarian space, specifically around our work with sexual and reproductive health and gender-based violence. So we've got a range of interventions that we're working on through different humanitarian responses that have happened here in the region in the last couple of years. So after Cyclone Harold in Vanuatu, UNFPA supported the Vanuatu Family Health Association to work with the Vanuatu Society for People with Disability to do outreach to provide life-saving SRH and GBV services. So they paired and went together out to the communities to deliver SRH information and services. And the Vanuatu Society for People with Disability was really crucial in helping to identify the people with disabilities in the communities so that we could reach them and provide services. We've also worked with the Pacific Disability Forum and IPPF to develop a disability inclusion module for MISP training. MISP training is the minimum initial service package that UNFPA supports at the onset of a crisis. That's been translated into 6 Pacific languages and has been piloted in Kiribati and Solomon Islands, largely with the IPPF member associations. So we're now able to have a more inclusive approach to programming. UNFPA has also adapted, working together with the Pacific Disability Forum, has adapted women with disability dignity kits. So we had standard dignity kits, but then working with our partners have adapted those to ensure that they meet the needs of women and young people with disabilities. In the Tonga volcano response this year, we've also been engaged with DPOs to distribute these dignity kits. And last year, in the last couple of years, in Fiji, working with the Pacific Disability Forum, we trained midwives on gender-based violence referrals and case management during COVID-19 so that they would be more responsive to the needs of people with disabilities. So this is just a brief sharing with you, but I just wanted to highlight how important it is to have that 2-track approach, because if we think about this often in terms of, for example, women's empowerment and gender equality, we often talk about special measures that we need to take so that women can engage, for example, in political processes. And so this is a similar approach. We need special measures so that people with disability are able to engage and fully participate, but we also need to take into account that they should be part and parcel and mainstreamed throughout all the sexual and reproductive health services to allow them to fully realize their rights. Thank you.
Thank you so much, Kathy, and really sharing the huge scope of the mainstreaming that is being done as part of the transformative agenda and the support of DFAT to really ensure that disability inclusion is in every part of the transformative agenda. Unfortunately, we no longer have time for the Q&A just because we've run long today. So if you do have any questions, I note there are 2 questions already in the Q&A box that have been answered in writing. If you have any further questions, you can email Sophia. She will be putting her email in the chat, and she will make sure that your question is answered by the person best positioned to answer it, and that we get back to you as soon as possible. So Sophia's email is s.mineiri@womenenabled.org, and that will also be in the chat. So I will now be turning it over to Kathy, who will be closing us out and introducing our final speaker.
Great. Thank you so much, Sophia. And thank you to all the participants, all of the speakers. We've had such a rich sharing and discussion today. So I'd like to turn it over for closing remarks to Mr. Setariki Makanawai, who is the Chief Executive Officer of the Pacific Disability Forum. So Seta, you have the floor.
Thank you, Kathy. The director of UNFPA, Ayari San, I had a great pleasure of meeting him yesterday, and also to our colleagues from WAI, Susanna and your team, and also to the Department for Affairs and Trade, Government of Australia, then in Canberra. And to acknowledging Dr. Rachel from the Ministry of Health in Fiji, and to all our partners and to all our friends and colleagues that are out there in the region that have joined us here in Fiji physically or virtually. My task is to move a board of thanks to all our partners, but I think I really owe it to the sisters with disabilities for today. I had the greatest of pleasure to sit in and just listen and absorb the information that's coming through. And so many a time as the head of the organization, you don't get to hear the intricacies of even the pains, the aches, the success, the highlights of the struggle and the stories that I heard today. And I thank to all of you, as I said, my sisters with disabilities, whether it be the lead researcher, whether it be a key informant, whether you participate in those group discussions, and those of you that presented today from Vanuatu, Samoa, and in Fiji. I was going to say, like what Paolo did, this report is really for you. And dotted throughout this report, as evident today, is partnership. So I acknowledge all the partners that made this possible. We're telling a story that often at time, it's either untold or it's very hard to tell. This report is telling that story. And through the UNFPA transformative agenda, to me, that is the key word in this. We need, by telling this story through this report and the recommendations therein, transform our society, our practice, our policy, our attitude, everything regarding women and girls with disabilities and young people. They have told their story through this report. So, and one thing I really miss, and I want to say it here, whether it be provocative or not, I really would have loved this session today, and I don't mind being quoted on this, to be part of the meeting that's happening there in Nandi this week. I think probably today too. Dr. Rachel referred to a meeting in Nandi, I'm sure Angie was there too, whether it's that meeting, the regional meeting. This report needs to find its way there. So the challenge is on us as a partner to this, and also UNFPA. We need this story, we need this report to be part. If we are going to transform the way we do our business, this report needs to find its way there. It needs to find its way to be where it can make a difference and make a change. And I think our women as well, and I know it's not easy. They've shared their story. Some of them have shared that today. It's not easy to be talking about sexuality and disability. For me as a person with disability, but being a male, it's probably not as hard as being a woman or girl with disability. With all the different intersectionality, that your son mentioned that. But I think we really need to up our game. We need to change. We need to transform. And we're really hoping that as this project is closing, that DFAT will seriously consider supporting the next phase of this. We certainly would like, from PDF, say this to transform our society and transform the lives of our women and girls with disabilities. This story today should not continue. It will need to stop. And the buck stops with us. The ball is squarely in our court, on our shoulders, the responsibility to transform this. Maybe I'm sounding a bit, maybe it's out of order by supposed to be moving a vote of thanks, but I can feel the burden of what's come through, being shared through by our women and the sisters with disabilities and those of you that are working this. So I want to thank UNFPA. Thank you, Wei, for taking this on with us. And I thank for the pilot project through you, Dr. Rachel, Minister of Health and Services in Fiji, FDPF and the REF here, Fiji, and the partners. I was thinking your report in December will further qualify the Fiji report of this project. So I hope at a conference next year, probably make the first public announcement, the Pacific Region Conference that we run every 2 years. We're running one next year in February. We hope. I really would like to see this report be part of the conference, but not just being covered. We just don't want report. We just don't want documents. We want transformation. In the recommendations of the report, every area of our lives. Our sisters, our women, girls with disabilities, our young people with disabilities need better than this. And it's all on us to make it happen. So in thanking again our partners, thank you for this opportunity. Thank you, Director. Probably I'm challenging you as well, UNFPA, and as well as I'm challenging PDF and our partners way, and domestically, nationally, then Vanuatu, and then Samoa and in Fiji, and those other countries that are yet to be part of this wonderful transformation agenda, particularly on women, girls with disabilities, and young people on SRHR. Let's make it happen. Let's make it happen for them. We owe it to them. Thank you and God bless.
Thank you so much, Seta. We really appreciate those closing comments. Once again, we'd just like to thank all the participants for joining us today. Thank everyone that Seta has already expressed. So thank you to WEI. Thank you to Pacific Disability Forum. Thank you to DFAT for the generous support to this important agenda. And thank you to all the women, girls, men, and boys who participated in the research. As we've said, this research is dedicated to you. Thank you so much. And with that, we'll conclude the meeting. All of the reports will be available online. We'll be disseminating them. We hope you use them, and we look forward to continuing this important work with all of our partners. Thank you so much. Bye-bye, everyone. Thank you so much.
Bye-bye.
Oh.